Are you struggling with lower back pain? Have you gotten to the point where you can't even get through the morning or the day at work without pain? Hey, I'm Gina. I am a dental hygienist and a burst ambassador, and I'm here to talk about my personal experience with lower back pain, how I overcame it, and how I think you can too. A little bit about myself. I've worked full-time in dentistry for the past 12 years. I've always heard that working in dentistry can cause aches and pains over time, and I've even known hygienists who have had to retire or leave the profession due to long-term chronic pain and injuries. Of course, I never thought that would happen to me. I live an active lifestyle outside of work, and I just thought that would carry me through in keeping myself healthy in my profession as well. But about 3 years ago, I started noticing lower back pain creeping in my daily life. There were other aches and pains too that I noticed as I've gotten in my 30s, but lower back pain was a consistent one that kept showing up. And I thought it was related to the exercises that I was doing, like running, so I took a break from that for a while. I got prism loops that helped me keep my back and neck more aligned. I got a saddle chair to keep my back in a better position, but over time things just kept slowly getting worse, and I got to the point where I just couldn't even get through the day without my lower back being so uncomfortable that it was just really affecting my psyche and my day-to-day. So I started doing some strength training and staying consistent with that, but every day I would go to work and the pain was still there. I started noticing the pain on the weekends too, especially going downhill on my hikes. And then during the work week, the pain was a consistent reminder that just things weren't right in my body. And what was worse was not knowing why it was there and how to fix it, or whether it was going to get worse and affect me being able to do the things that I love to do outside of work as well, like run and hike, snowboard, climb. So fast forward to last March of 2022, and I decided that I needed the help of a professional. So I went to see a physical therapist for an evaluation. He first made sure that there was no actual physical injury that was causing me this persistent lower back pain, and then came up with a plan of action. From him, I learned that, guess what? Sitting all day, whether you're sitting at a desk or, in my case, dental operating chair, it's a serious problem because all your muscles start tightening up. Turns out, there's science behind all our fitness watches reminding us to get up and walk around every once in a while. So what he told me after my evaluation was that my hip flexors had shortened and weakened from sitting all the time, and that I was using them to hold myself up and lean to the side and forward instead of using the larger muscles like my core and my glutes. And I learned that my quads and glutes were also tight and weak, and my deep core muscles weren't engaging enough to support my lower back and to prevent it from causing pain. When your hip flexors are super tight, they shorten and they cause your pelvis to tilt forward, which in turn causes lower back pain because your lower back then arches too much. So I worked with him for about 2 months to stretch and strengthen these muscles, and it has literally taken me a full year to retrain my muscles and get out of my old habits. And I'm still working on it every single day pretty much. I say this because everything we see online are these easy fixes like do these 3 exercises and everything's just gonna fall right into place. Well, guess what? Even for a young, healthy person, which I consider myself to be, our bodies take time to heal and change. So if you're like me and you have slowly started getting these aches and pains, especially in the lower back, please don't get discouraged. You really don't have to live with this pain. There are stretches, exercises, things that you can do that will actually relieve your pain, but it does take commitment, consistency, and it just takes time. For me, all this time and effort was worth it, and I think it will be for you too if you are struggling with the same thing. My PT program was a 2-phase program, but today what I want to show you are 5 stretches from the first phase of treatment that started to expand my flexibility and mobility and help me to get out of pain. This one's called World's Greatest Stretch. You're going to bend your right knee, stretching your back leg behind, put your forearms down on the ground, open up your right knee so that you can open up your hip. Then you're going to put your arms up, right arm toward the right side to stretch out your back. You're going to bring your hand back down, go down on your forearms, let your right knee fall out to the right to open up your hip. Repeat these 2 motions 10 times and then do the same on the other side. Second one is a half kneeling quad and hip flexor stretch. Kneel with one foot in front of you. You're going to tuck your tail, push your hips forward until you feel a stretch in the front of the leg that's behind you. And then you're going to slowly rock your hips from side to side 10 times. You can use a towel or extra cushion under your knee so you don't hurt your knee. After that, you're going to rock your hips front to back 10 times, very, very slowly. You want to maintain a flat back and not arch your back. Then you're going to switch and do the other side. This is going to be the pigeon stretch. You'll start on all fours, then you'll cross a leg in the front, and then you're going to extend the opposite leg behind. Keep your hips and shoulders facing forward, your spine straight and tall. You're going to hold the stretch for about 30 seconds. Do it 3 times on each side. And you might notice that one side tends to be more easily stretched than the other, and that's okay. To do this stretch standing up, I usually use my desk or a bed. You're going to lift and rotate one leg and place it on the table, and then the other leg remains extended with the foot flat on the floor. Your torso and spine should be in a neutral standing posture, and then flex the stance leg to feel a stretch in the hip. This is called a glute bridge. Lie on your back, knee pulled up to your chest. Wrap your hands around your thigh, keep the knee in place. Tighten your abdominal wall, squeeze your glutes, and push into the ground with your heel to lift your hips up, and then slow and controlled lower your hips. Do this 10 times on each side, and then you can work up to doing 2 to 3 sets on each side. Position a lacrosse ball right in the meaty part of your glutes. You're going to sit on the floor, position the ball under the meaty part of the glute. Slowly open your hip to the right side, bend your knee to the right side, and lift it back up. Do it 5 times on each side, and you can slowly roll the ball around to release the area too. Thank you so much for watching this video. If you have any questions or if you tried these exercises, let me know in the comments below. And as always, if you like this video, if you learned something today, give it a like and subscribe to our YouTube channel because we have new videos coming out every week. And let me know also if you want a part 2 where I give you more of the stretches and strength that gave me my flexibility and mobility back.